Welcome to the after show. This is the after show for House Calls, where we answer your real questions about health. And today, joining us are Dr. Cook and Dr. Lyons to talk about school safety in the midst of COVID-19. Doctors, welcome back to the show. We just had a very lively conversation about school safety. Parents are really concerned. We've gotten questions from all over the world. What did you think about the first part of our conversation today?
I thought it was a great opportunity. Great to be in this type of setting with a superintendent, knowing that the needs inside schools and teachers are very different than probably what we think of on the health side of things. But at the same time, trying to have this open dialogue and hopefully answering people's questions, trying to reassure them with the facts.
And Dr. Cook, you're a pediatrician, is that correct?
That is correct. I'm a pediatrician. I'm also trained in adult medicine, but I haven't been seeing adults in about 12 years now. But it's really important to have that kind of background when we're thinking of the trajectory of children's health, not just through childhood, but into adulthood.
Yeah, and Dr. Lyon, you were a superintendent of schools in Frisco, Texas for many years, and now you are working with the American Heart Association.
Right. I came to the conclusion about 10 years ago. It's an epiphany that I had that is might reflect my intelligence, but it basically was that if we don't take care of the health and wellness of our students and staff, all of our learning goals ultimately are probably going to fall a little short. So I got very serious about examining conditions of health and wellness for students and staff in schools, and was very proud to kind of do some work that led the way on building into our strategic plans and that kind of thing. Those elements that now are all captured with the whole child model to improve outcomes for kids by actually just kind of centering things on what Maslow talked about, that foundation of good health and good sleep and good practices to help the child be ready to learn and be successful when in those learning exercises.
Yeah, and if I didn't say so earlier, my name is Dia Smith Taylor, and I'll be your host today. And listen, we never realized before just how much health and education intersected until COVID-19. And now you see just how much we all need each other in these various disciplines and how it really affects your lives. And in that regard, we have questions from all over, and we'll start with a couple of questions we got from Facebook. Christina St. John says, if we keep our kids away from other kids for a long period of time in other places like grocery stores, parks, etc., how will that affect our child's immune system when they're back in the public?
So that's a great question. But the reality is that while keeping them apart at this age, at school age, it does keep them healthier. They're less likely to get infections. Once the lockdown occurred in our region, we weren't getting calls about strep throat or ear infections or asthma attacks, because a lot of this is triggered by infections. But the immune system is already much more exposed and mature at a school-age child. So this isn't going to set them back or make them more susceptible to other infections because they're not getting exposed to it. But it's a good question to answer, because obviously people are thinking this, and it's not the first one I would have thought of, but someone's been thinking of it, and we want to reassure parents that going through these steps, there's going to be side effects. There's going to be some bad outcomes potentially from this, but that's probably not one that we really have to worry about at all.
Deborah England North wants to know about children with congenital heart defects. Should they be going back into the classroom?
So the congenital heart defects are a group of kids that we know about, the idea that they are at higher risk of getting complications if they get an infection, but they're not much more susceptible to getting infection unless part of their treatment involves their immune system being immunocompromised from perhaps other surgeries or medications they're on. So it's really important to talk with your pediatric cardiologist, talk with your primary care doctor, and if they need to even discuss with an infectious disease specialist what that risk is, it's definitely worth the call, because they are at a bit higher risk than the average child. So you want to take those steps precautiously.
And I think you both can probably weigh in on this, because as we were talking and thinking about this conversation, I'm thinking about daycares, right? Where there's a lot of liquids happening and you have to change kids and these kinds of things. are there protocols in place for teachers in terms of how they interact with children who are really young and they need, to be changed, or they need their nose wiped and things of that nature?
I haven't seen any of those protocols. I don't know what that environment looks like, to be honest with you.
That's probably actually something that's been out for a little bit longer in the daycare community. Daycare protocols have been around more than the school protocols have been around. So it's probably out there. It exists. People have had these questions in group chats we've had around, diapering and things like that. There's not really a lot of data, and there doesn't seem to be any noticeable risk at all around, a diaper change or, the child urinating. It's respiratory type of thing. So the kid who coughs and sneezes on you is a far bigger concern. But like anything, have good hand washing, take appropriate steps, be very careful because, it is a bodily fluid and it could be something else you're exposing yourself to.
Now, along those same lines, Mike Mirabito is asking, considering that children can be asymptomatic and spread the virus to other children or teachers, in the same manner, many teachers are considered in the high risk range, age, medical conditions, etc. Which precautions are being taken to prevent further spread?
Well, I know, for instance, I've looked at numerous school plans where, unfortunately, everything's been stripped out of the classroom. So all the teachers' personal belongings, all of those kind of warm and fuzzy things that a teacher kind of builds into the classroom, those are gone. The teachers, there's now diagrams of classrooms where the teachers are to be in terms of their desk and where they are to instruct students from. And some have even gone as far as, I think there is some plexiglass out there, not necessarily just in one particular area. So there are definitely things happening regarding creating a safe environment for teachers. And I think that it's really going to be up to every individual teacher to assess that that set of conditions versus their own health condition, and then work with their school administrator to decide what they're going to do. Some districts are giving teachers options to teach 100% online. I don't know how that's actually going to work at the end of the day, but districts are certainly trying to work with those teachers that present health risks and get them away from the live action in-person instruction as much as possible.
For people who are going to be in the classroom, how are we doing lunch and activities outside of the classroom? Because sitting and being sedentary all that time can be very difficult for students. So what's the balance there?
This is where right, and this is all weather dependent, right? The outdoor classroom concept that Dr. Fauci speaks about is absolutely true. You can only take so much seat time in a classroom, and I was one of those kids. I don't know what I'd do in a case presented with having to wear a mask for 6 hours of instruction in a desk. It's not possible for a young child. So administrators and teachers understand that. So let's get them outside for recess. This whole concept of pods and little cohort groups has a lot of merit when it comes to feeding and recess and music programs. You can do some kind of separation and some creative solutions regarding keeping those class sizes small. So I think school districts, the power of taking a walk is immense. And having kids go out and stay 6 feet apart and walk around the playground or the track, these are good practices, and kids will view it as freedom very quickly. So I think we got that part too.
Well, that's interesting. You mentioned the 6 feet, because one of the questions that Greg from Oklahoma is asking is it really reasonable to expect kids to stay 6 feet apart? They miss their friends. They want to be close and interact. How do you manage that?
Very carefully. I mean, it takes a lot of effort. So for the kids to be like that all the time is going to be very difficult. But the reality is that kids are getting used to this. Again, nieces and nephews of mine in daycare asking my great niece and nephew, but asking my nephew how they do. And they're like, they're doing okay. They have little rules, hands up, airplane wings. And that's how far apart they stay. They talk. the good thing is younger kids, 9, 10, pre-adolescent definitely, seem to have less of a susceptibility to the infection. They don't seem to transmit it as much as adults, as adolescents. So there is an inherent kind of protective factor there. They're not as big a risk as really the rest of the population. So that's helpful to hear. Hopefully that's reassuring. You still want to get kids used to these patterns and behaviors because that's the reality. They get used to this and they'll probably do much better than we think. Yes, we want them to play and be interactive and stuff, and we're not going to shame them or punish them for doing that, but they'll also pick up this routine really quickly as long as we, the adults in the room, are positive, are responsive, and are modeling these behaviors ourselves as well.
Let me add one thing to that. That's exactly right. What it really comes down to is the modeling by the adults in those states where they are taking all of this very seriously and they've got this thing under control. The kids will understand what the adults are doing. But in those states like Texas, where I was out yesterday and I saw 200-300 people congregated, 10% were wearing masks and no social distancing. And there were kids sprinkled in that. Well, that creates the problem, is that if we don't walk the walk as a society, as a community, and then all of a sudden we put kids in school and expect them to do an about face, we're in for trouble. And so we've got to, for those states that are struggling with the adult compliance of social distancing and masks, that's job one, actually.
Yeah, no, you're right. And I know neither of you are psychologists or psychiatrists, but I just wonder, in your observation so far with kids, is this causing any anxiety in terms of their ability to interact with people, right? Because they want to hug, but you can't. And so you're learning all these new behaviors. Do you know, or has there been any kind of studies that show there might be some long-term effects in relation to their ability to engage?
Yeah, that's one of the big concerns, that children being in these isolated situations is not great for their social, emotional development. And sometimes the school is a safer environment for some kids. So the reality is getting kids back in as safe a way possible for everyone involved, based on what is the spread in the community, is important. So right now, if a community is, really kind of in the middle of the fire, it's not really that feasible. But as things cool down, if a community is under control, getting kids back, because getting some type of interaction is better than nothing. And the more you can get them, the better. So we do have to keep that in mind, especially in the youngest children. And thank goodness for this. They're also the group that doesn't seem to get as sick and doesn't seem to transmit as much. It's information that's still emerging. We have to keep an eye on it, but it is something that's reassuring. And we still need to use the strategies of hand washing, masking, and distancing as much as possible.
Not an easy task. This next question is for both of you. Hanan El-Arab asks, what about the food as probable way of virus transmission? And in that same question, how is lunch being handled, or breakfast, for kids who are going to be in the classroom?
Well, the concept of satellite kitchens that pre-prepare lunches and breakfasts, and it's whether you describe it as lunch in a sack or whatever, that can all be deployed school-wide with complete confidence in the food handling and the sanitation. So, really that was not a difficult pivot for school districts, because they had already kind of gone to this model and gotten very, very good at producing very sanitary lunch kits for lots of kids quickly and very efficiently, and with high quality sanitation protocols in place. Not a hard thing to do for schools.
Right. The question about meals comes up, and it's not really any data suggesting that the virus is transmitted in food. But if you are sharing utensils, sharing cups, that's where a potential spread could occur. But, is the cooking staff washing their hands? Are they clean? Hopefully they are, but that is not nearly the source risk that you need to be worried about. Of course, if they are sick, they need to be isolated and follow the appropriate contact tracing. But it doesn't mean that children who got meals from that person are considered exposed. Now, if they were in the same room with them for 15 minutes or longer in close proximity, maybe without a mask, then that's different. But the meals and the sandwiches themselves aren't going to be transmitting the virus. But if you're sharing utensils or sharing cups during lunch, breakfast, that's where a risk can come up.
Dr. Lyon, you mentioned earlier that we should just go ahead and prepare ourselves, that there will be some positive cases of COVID-19 coming up. And then as I was thinking about that, Dr. Cook, people have been talking about some long-term effects of COVID-19 after they're no longer positive, but then there are still lingering issues such as, your ability to think the same, your energy level and all of these things. So I'm just thinking about thoughts about how this is going to impact both teachers and kids who are, having rigorous curriculums and, after they're positive and then, they're out of quarantine, their ability to learn at the same rate or communicate or think at the same rate.
The health consequences are still things that we can't predict. We're still learning. And we know people who are having severe infection, one of the signs is clotting. So the concern is, are they having mini strokes? Are they having the brain is getting directly injured itself from the infection or from lack of blood flow? So that's always a big concern. With children, anything we see in adults is a potential concern to kids. Thank goodness we're not seeing nearly as many severe cases in kids. We know there's an inflammatory syndrome that rarely occurs in some children after an infection. But we have to keep our eyes open. To say kids are going to come out, scot-free without some long-term problems, we just can't say that. The good news is that there's not signs so far that children are having that. With adults, again, if they're having more severe infections, we see that, and we see definitely signs of fatigue and recovery, and whether that's a persistent lingering infection or something else. It's something we just can't predict, and we've got to be prepared to try to address it and deal with it.
From the school district perspective, we are very successful with dealing with children who, for whatever reason, are absent from school, either for one long period of time or because of an underlying health issue, miss school frequently for 5-10 days. Now we're going to be doing a lot more of that, but this underscores the importance of having that redundancy where the instruction that's delivered in the classroom is identical to the instruction that a student would receive online at home. And that's what school districts need to be doing. The fourth grade teacher, the lesson that she delivers throughout the day should be identical to what's happening in the online environment. And that way, now you have the opportunity for the student to keep pace at home. And then again, when they're ill and they can't even get online because they're ill, at least that content is there because it's all taped and they can go through and make up and catch up successfully. So I think we got that part covered pretty well.
I really like when we talked about teachers being on the front lines, and they really should be valued more. And I'm just wondering, as we think about people who are going to be sick, because it's going to happen, as you said, is the protocol in terms of returning back to school the same as it is someone who is not on the front lines? In other words, if I'm a teacher and I got COVID-19, is 14 days enough for me to be away from students after I test negative?
So I've had extensive conversations with all different levels of educators about that very thing. And, to be honest with you, the anxiety and stress of teachers is extremely high right now. Teachers are very nervous about going back into the classroom. And were a teacher to come down with a case of COVID and go out, I'm not confident at all that they would return that semester at all. I don't see any degree of a teacher saying, well, I'm going to quarantine for 10 days because I've tested positive. I think they're going to be a little gun shy at that point to return to the classroom, to be honest with you. That's one we're going to just have to see how it plays out.
Yeah, it's going to be a real challenging situation. It's a balance of needs and wants. In some case, you get people who get a mild illness and it's found to be COVID and they seem to recover. You want to make sure that they're cleared to recover, and understanding how testing is working, because some people are finding they're still having a lingering positive test, and it's not because they're infective or sharing the virus. It's just that there's some particles still in their throat or something. If someone has a severe infection, severe case, you let the medical course dictate it. But if someone, recovers minimally with a very mildly, minimally symptomatic type of case, I think if they're medically cleared and they're willing, they should, they're fine to go if they've met all, met the health requirement and safety pieces. Now, the comfort level with that, the safety level with that is also really important, which is a different issue. So it's going to be a real tricky balance. It's going to be important to understand what local laws and rules apply around this. And it's really important with kids. I mean, we're looking at this in New York as if a kid is positive, when can they return to school? They're looking at 3 days without a fever before returning to school, which is much more than we use on usual infections, 24 hours without a fever. So that's a much bigger standard that we're setting. So it's important schools understand we're trying to do that. And again, Dr. Lyons and I have said this, this is where the community needs to understand this. This is where employers need to give parents that flexibility to be home with their child for that period of time. I can't say it enough, because punishing a parent or a family because of a situation like this is just beyond insult on top of injury.
Yeah, so true. And finally, we have a question from LinkedIn around vaccines. We're coming up on flu season, and some people have concerns about vaccines. I'm wondering, with flu season coming up, are there any new recommendations around, vaccinations? What should we know? What should we do or not do?
Well, we really need to work with communities on their level to be comfortable and understanding. The rise of vaccine hesitancy in this country is just unfounded, because we have parents and people questioning vaccines that have been around for so long and are so safe that it's unbelievable, but we love a good conspiracy theory, I guess. What's really important is actually the other things we're going to do. Social distancing, hand washing, less dense rooms of kids and kids not interacting. So that will protect us a little. But when flu season comes, we know kids transmit flu to each other, to adults, much easier. So it's going to be important to try to optimize getting all your vaccines, getting them up to date, washing your hands, and then understanding where families may have hesitancy around the COVID vaccine. One thing the CDC is looking at is a dual test, a test that can be done on a nose swab to test for both COVID and flu, which will be really important, because our concern is that these two could look the same. And so unless you're able to do, really test for both at the same time, we're not going to know. But we got to wash our hands as well as get all our shots.
And Dr. Lyon, finally, on that same vein, what has been the protocol in the past around flu season? How is that normally handled in the classroom?
Well,
or vaccinations, for that matter.
Well, I'm gonna make a T-shirt that says, and this applies to every school district out there: follow the science, follow the science. And we have this responsibility to cut it out, cut this nonsense out of this rhetoric and this set of false beliefs about this, that, or the other. We've got to listen and follow the science on this, and I think that's what this pandemic has shown. It's an incredibly frustrating issue, the whole vaccination issue. And frankly, I don't believe that school children whose parents do not allow them to be vaccinated against some of these diseases that we've basically cured should be allowed to interact with other children and compromise the health and safety of everyone. But that's not for me to say. I do believe we've got some serious issues there. And unfortunately, the root question that you asked was about flu season. We cope, we manage, we encourage everybody to get the flu shots, but we still have a lot of it in the schools. And
but it's not required. Those vaccinations are not required.
Right, exactly. And we've learned a lot. There's a lot of silver linings from this pandemic regarding how public health policy in schools. And I'm very optimistic that a lot of really good, sound, follow the science practices are going to come back hard into our public schools because of this experience with this pandemic.
Yeah. Listen, there's so much to learn. You certainly helped us in the process. So many people have angst and questions, and we had so many overflow questions from our live show. So thank you for taking the extra time on our after show to do just that. We want to thank you so much, Dr. Lyon, Dr. Cook. This has been the House Calls After Show. I'm your host, Dia Direct, and it's been a pleasure to be with you today.
Thank you.
Thank you.
Learn more about House Calls, Real Docs, Real Talk, and submit your questions at heart.org/housecalls.